Over the last few days, I've actually received a few questions that are about the exact same thing. And so I thought, oh my gosh, obviously this is something people are wondering about. I've got to make a video and explain. So I recently released an e-course called The Circle Solution, and you can go to thecirclesolution.com to check it out. It is a wonderful course all about hip circles and all sorts of other forms of flowing, multiplanar, multi-directional movement that strengthens your core, all of your core muscles, and helps you to prevent joint pain, back pain, hip pain, that kind of thing. It's a wonderful course, highly recommended. And I've had a few people ask me specifically about Prolapse and whether or not it's a safe exercise program if you have pelvic organ prolapse. Now, if you have prolapse, it can be difficult to know what exercises are safe and what are not, what exercises are going to aggravate your condition. So if you're not familiar with prolapse, in a nutshell, it's basically when your pelvic organs, your bladder, your uterus, your rectum, are essentially hanging a little bit low. So what you want to avoid when you have prolapse is often high impact motions that can really put a lot of pressure, downward pressure on those pelvic organs that are already hanging a little bit low. You want to also avoid motions that involve a lot of crunching in this area because again, that can put downward pressure on those pelvic organs. Now, as far as my Circle Solution course, if it's safe, yes it is, and I'll tell you why. The reason why it's not only safe but beneficial for pelvic organ prolapse is one of the things you want to do when you have prolapse is to keep the core and pelvic floor muscles supple and strong and flexible and a lot of circulation going to that area. And anytime you're doing motions that involve this area of the body, anytime you're bringing a lot of movement to this area, it's going to be bringing blood flow to the area, circulation. And to keep the tissues, the muscles, of course the connective tissues, the bones and the joints as well, to keep them healthy, you need to have a lot of circulation coming. With circulation comes blood, obviously, is circulation, but with blood comes oxygen, nutrients, all of those things that your tissues need to stay strong, healthy, and supple. So, yes, the Circle Solution is all about motions of the pelvis, the hips, the back, this whole area in here. So it's going to be great for keeping the pelvic floor and the other muscles in this area strong and healthy. So as far as specifics for prolapse and the Circle Solution, I just have a few things that you might want to think about. So the exercises are safe, but there are a few exercises that do involve a bit of a tailbone tuck. So it's called a posterior pelvic tilt. It's when your pelvis is tilting back and you're essentially tucking your tailbone under. So in these situations, if you do have prolapse, and really anytime it's just a good exercise for body awareness and feeling what's going on in your body, anytime you're having that tuck action happen, you want to engage your pelvic floor muscles. So do a very gentle Kegel and pull your belly in and exhale. So just be sure that you may need to take the moves a little bit slower than I instruct in the videos or slower than somebody else might take them. But you want to be sure that when you are, for example, scooping forward with your OMI, that little tiny hip circle, that when you come forward, you're lifting your pelvic floor, so just kind of feeling the Kegel muscles, those vaginal feeling muscles, the pelvic floor, feeling those muscles engage gently, like you're pulling a marble into your body, and then feel your low tummy pull in and exhale. So, I hope you can hear that, and I hope that makes sense. It's just a good idea to know how to do that anyway and what that feels like. It's a supportive way to keep your, to use your body when you're doing any exercise that involves a tuck of the pelvis. You want to think about supporting the pelvic organs that have prolapse by engaging the pelvic floor muscles so you're supporting from below, and then exhaling so your breathing diaphragm is coming up and not causing a huge increase in downward pressure. So again, it's a lift of the pelvic floor, pulling in of the abs, and an exhale A lot to think about, I know, but it's gonna feel really natural once you start feeling what I'm talking about, feeling in with your body and realizing that any type of crunching move like this, or like a sit-up, which I don't do in the Circle Solution, but in other exercise programs, crunches, sit-ups, that kind of thing, you want to be sure that you're supporting from below and exhaling when you do those types of moves. So again, to sum it up, the Circle Solution is safe and very beneficial for women who have prolapse, but you do want to take extra care when you're doing some of the moves that do require a little bit of a pelvic tuck or a posterior pelvic tilt. So I hope that answers the question. I hope that makes sense. And if anybody has more specific questions, you can always email me. I'm Brianne at FemFusionFitness.com, and I'm so happy to answer your questions. I just really am so passionate about helping women understand their bodies, feel into their bodies, support their health with fitness and wellness programs that will make you a happier person. They're going to make you feel better, feel less painful, feel stronger, feel more confident, more secure in your own skin, and just really get to understand and feel your body better. So enjoy. We'll talk to you soon.